First of all, I'd like to say thank you. I'm flattered to have been nominated as Member of the Month for the Nassau County Medical Society. My name is Dr. Ian Michael Storch. I am a gastroenterologist in private practice in New Hyde Park, New York. When I started in college, I really never thought I was going to be a doctor. I actually thought I was going to be an English teacher. I was an English major in college, and I loved literature and loved a bit of history, and really medicine was not on my radar. I lived with another student who actually always wanted to be an emergency physician and was very involved in EMS. We were driving in a car to get some food the first day of school, sophomore year, and we witnessed a very bad motor vehicle accident. And my roommate, Gary, jumped out of the car and was so excited to use his EMS skills and help the woman, and I really felt very helpless. And at that point, I realized that if I had been by myself, I would not have been able to do anything. And I really respected Gary for having that knowledge. I became interested in EMS. I really felt a passion about EMS, and I became an emergency medical technician and rode with an ambulance company. And at that point, I decided that a career in medicine was definitely for me. That passion led me to go to medical school and pursue a medical career. Gastroenterology, again, was not something that I had in mind. I loved internal medicine and still do. And when I was a medical student, I just met a wonderful gastroenterologist who was caring and kind and really took time to teach me. And I really respected his relationship with patients. And that sort of spurned my love for gastroenterology, mainly just because I wanted to be like him. The pandemic was obviously a difficult time for everyone, especially in New York. Nassau County, obviously, being a hotspot for COVID, we were closed. You know, as a gastroenterologist, my office was basically closed. We stopped doing procedures in the month of March, and that was sort of the end of that. I was sitting on the couch with my wife and watching Cuomo really giving this call for help. And I knew that I couldn't sit and do nothing. So I had full respect for all of my internal medicine and family practice, primary care colleagues who were doing televisits and keeping people out of the hospital. And I think that was a huge part of really helping the community. But for me, I was doing nothing. So I called a few of the local hospitals, including the North Shore System and CHS, and I was able to, one, spend time on a COVID floor in Syosset taking care of COVID patients. I actually worked on a COVID pneumonia floor and helped with some admissions at Mercy Hospital. I think the main thing that I took away from this experience was, number one, we don't always have the answers, unfortunately. You know, medicine is amazing, but sometimes we're hit with a curveball and we don't have all the pieces that we need. It takes time to develop treatment algorithms and vaccines and these types of things. And our medicine sometimes might not be as potent as we would like, but the human part of medicine, the caring for patients, the human part of what we do is always important. And I think that one of the main things that doctors did for patients and their families during the pandemic, especially when families were not allowed in to see loved ones who maybe were not going to make it out of a very difficult time, was just to connect with the families and connect with the patients and let them know that we were going to do our best to help them no matter what the situation was like. I definitely love the practice of gastroenterology, but I think it's little projects in different areas that keep us all excited and fresh. Two projects that I've been working on over the past year. One is a podcast, which I think is a great vehicle for conveying information. The name of the podcast is DO or Do Not. or doordonotpodcast.com. In this podcast, I teamed up with a bunch of osteopathic students from across the country who are all also excited about osteopathic medicine to teach pre-meds, medical students and residents about what is possible and what the degree entails. Really, really a great project, and it's been an immense amount of fun. The other thing that I've done over the past year is I was invited to be on the board of directors of the Empro Insurance Company, which provides malpractice insurance for doctors. The company is amazing, and the group that runs the organization is spectacular. The doctors on the board are amazing, and it has been a remarkable experience. I would say everything that I love, I utilize on a regular basis. And that does not include medical texts. That would be Star Wars, Marvel movies. I love to read biographies. If you want to read something crazy, Bad Blood, which is the story of Elizabeth Holmes, is awesome. And I think another thing that really helps me is my travel, my experience, my family, and the things that I do on the weekend. I think half of being a doctor is just being nice and engaging with patients and being able to share experience. I think that's what makes them feel comfortable and allows you to build trust. And I try to share everything that I do and everything that I am with my patients on a regular basis. And I think that's part of what makes my job so much fun, both sharing and receiving and listening to patients and asking them about what they're doing and what they're reading and what they're watching is just great. It's just amazing to work with people. And I think that although jobs like finance, I'm sure, are great and cool, I don't think anybody can beat a doctor as far as a cool job to have. Success to me in my medical practice is easy. I think every time that I get a handwritten card from a patient, it sounds so silly and cheesy, but that just says, "Thank you, Dr. Storch, for everything that you've done for me or my family member," I think that's what I define as success. I don't think there's anything better or anything more important than that one individual person whose life that you've changed or helped or made better in some way. And again, getting back to some of my earlier points, I think sometimes just being there for people in their time of need, maybe their worst time, and helping them through those times, even if you're not actively doing something, or, sometimes there are just situations that you can't fix. Just being there for those people makes the biggest difference. And again, those cards of thank you are really what I gauge, what means success to me. When I was a medical student, I remember one of the best pieces of advice that was given to me was from one of my mentors, David Elkowitz, who's now Associate Dean at Hofstra Medical School. And I was so overwhelmed. I remember medical school, there is so much to learn and so much to do. And I really felt like there was no way that I was going to learn everything. And Dave was just so smart and always seemed to know everything. And I went to Dave and I said, "I am never going to know as much as you know. I am never going to be as smart as you." And he told me one of the best pieces of advice that I've ever heard, and it's so simple, which is you have a lot of time to learn. And if you just learn one thing every day, just one important thing every day, in 365 days, you will know 365 things. And when you multiply that over the years of your career, you're gonna know a lot of stuff. So that's the advice that I pass on to students, and I think really was the most beneficial to me and really struck a chord with me. And I really think that's true. I think medicine is not a sprint. Medicine is a marathon, and you have a lot of time to become a great physician. I've been a part of the Nassau County Medical Society for as long as I can remember. I think it's very important to be a part of larger organizations like the American Medical Association, but also really the places where we impact the most, the pace that we practice, which is Nassau County. And I think the friendships that I've made through the medical society, including people like David Podwall, has really made practicing medicine much more enjoyable and really made a huge difference.